Uh, Today's video will be on a very important topic, and that topic is infertility. And the video will be in two segments. The first segment is describing infertility, the presentation, and the causes of infertility. The second segment will be on the management of infertility. But for you to understand, what we define infertility is inability of a couple, a man and a woman, to achieve a pregnancy after 12 months or even 6 months of regular, unprotected sexual contact. The timing of the division in definition depends on age. When you have an older couple, a woman over 35, and who is very anxious to get pregnant, then within 6 months you should investigate. A young couple in their early 20s just got married, you can afford to allow them a year of regular contact. And if they fail to get pregnant, then you can come back and investigate. One thing which we advise against is that you don't investigate a woman to find out if you can get pregnant. No, you investigate infertility. We don't investigate it to see if you can get pregnant. That's unethical. You have to try. And when you're investigating, you investigate a couple, a man and a woman. Very often a woman is blamed. Go and they'll investigate yourself. I'm fine. It's wrong. So you investigate a man and a woman. The reason is this. Only about 15% of couples approach gynecologists with the complaint of inability to achieve a pregnancy. The other 85% get pregnant on their own. And when you investigate that 15%, you find that in 40% is the woman's fault. In 40% is the man's fault. In 10% is both. In 10% is unexplained. So the fault is equal on both sides. But the idea of blaming a woman because she may have had a termination of pregnancy, it's not true. Then, by the way, termination is safe if it's done by a qualified doctor. I mean, and these days we don't even do invasive termination because using instrument, use tablet. It's like you having your menses, so it doesn't affect your fertility. That's one myth. The second myth is that if you do termination, you're losing more egg. No, you produce only one egg every month. To understand infertility, I take you to this chart of the female reproductive system. The reproductive system consists of the vagina, the womb or the uterus. The womb has 2 fallopian tubes. The woman has 2 ovaries. The ovaries contain eggs. When a female child is born, she's born with a fixed number of eggs in each ovary, millions of eggs, but no 2 females have the same number. The more eggs a woman is born with, then the luckier she is, the more fertile she is, the longer she will menstruate. And vice versa. The fewer eggs you're born with, it's bad luck. The earlier your menses, the less fertile you will be, and the earlier your menses will end. A woman does not need the eggs until when she starts menstruating around the age of 9 to 15. Now it's even going lower than that. But what happens is that the eggs in the ovary are not mature. They have to grow to attain maturity. The day the woman starts menstruating is the trigger of the growth, what you call the first day of the cycle. Thousands of eggs begin to develop from one ovary. The ovaries alternate. This one this month, the other one the next month. The egg grow for anything between 10 to 16 days, depending on the woman's cycle. After all that, only one egg, occasionally 2, will mature. The ovary, as you can see, is adjacent to the fallopian tube. The ovary will now rupture to release the mature egg. That mature egg goes into the tube. The entry of the mature egg into the tube is what we know as ovulation. That egg survives in the fallopian tube for 48 hours. It's available for pregnancy for about 12 hours of that. If the woman has sexual contact with her male partner when the egg is in the tube, the sperm is released in the vagina. There are millions of them. The sperm is like tadpole. It swims upwards from the vagina into the womb, from the womb into the tube. Only about 5,000 will get into the tube. Out of that 5,000, only 1 will be able to join with the egg to form the pregnancy. The journey of the egg and the sperm in the tube is what we call fertilization. 3 days after fertilization, the pregnancy now returns to the womb where it implants on the lining and begins to grow. The point to make is this, that before making love at ovulation doesn't guarantee pregnancy. There's only a 25% chance of pregnancy every month. But the average woman who is okay should get pregnant within 6 months. So it's important to make this obvious to the woman. So we further define infertility as primary infertility and secondary infertility. Primary is the woman who has never been pregnant in her life, while secondary means a woman who has had a pregnancy, whether she had a miscarriage or delivered a baby, she's been able to become pregnant, and then subsequently she has become unable to become pregnant. So the reasons for that are quite different. So that's it. So we'll have primary infertility and we'll have secondary infertility. The issue now is, what are the factors that are responsible for pregnancy? There are 4 main factors. One, for a woman to get pregnant, she has 2 fallopian tubes, but she only gets pregnant from one of them. So at least one tube must be open. That's what they call the tubal factor. 2, the man's sperm must be adequate in number and possess enough speed to travel from the vagina to the womb. Because if the sperm is not fast, even if it's 100 million, they will all die here. Nothing will get to the tube. And such a man, despite the number of sperm, can never get a woman pregnant. The third thing we need is egg. The woman must be ovulating regularly. And lastly, like I mentioned, this is a factor that's always forgotten. The egg survives for only 2 days out of 30 days. The woman must make love on those 2 days. And in most cases, you find where a couple, the husband lives in Sokoto, the woman is in Kaduna, and they meet only at weekends. Ovulation cannot be conditioned to occur when they are going to meet. It will occur when it's supposed to occur. And most women don't know this, and it causes a lot of problem with couples where they've married for years, but they don't make love because of job circumstances. They live apart and they cannot live together. But it's the responsibility of the doctor to ask that question when you're taking a history. Are you living in the same town as your husband? Are you the only wife? Because sometimes the day, if you have a polygamous family, the days are shared. Your ovulation day may not coincide with your time when you're supposed to meet your husband. Then you have to bargain with your mate. But these are small factors we tend to ignore. And we keep wasting, poor woman keeps wasting, being harassed by no fault of hers, just because we are ignorant of these facts. The little things, but we call it separation. So these are the 4 main factors: the tubal factor, the male factor, the ovulation factor, and the separation factor. Because if you're not together, it's difficult to get pregnant. So these are the 4 main things we need. These are, to recap, it takes 2 to make a pregnancy. 1. 2, the woman's egg only survives for 48 hours in the fallopian tube, and it's only available for fertilization for 12 of those 48 hours. So it's not that much. 3, the man's sperm, the male factor, the sperm being thick like pap or being watery like coke, it's irrelevant. Some men boast that their sperm is so thick like akamu, as Nigerians call pap, and the other one is very watery. That's completely ignorant. A sperm can be as thick as pap, but when you check it, what a man produces actually is called semen. We don't call it sperm. Sperm makes up only 25% of the semen. So you can now examine the semen and find that even though it's as thick as akamu, it contains no sperm. The one that's as watery as coke contains millions of sperm. So don't go by that. Women get easily fooled. That, oh, because the sperm is very thick, it's okay. It's not okay. You don't know. Medicine is evidence-based. Evidence means investigate, get the facts. Then you can say, look, your sperm is, this is the number of sperm, this is the speed. Do the x-ray, your tube is open, and then check whether ovulation occurs. Ovulation is easy. A woman who menstruates regularly means she's ovulating regularly. Because menses, the lining of the womb grows every month, waiting for pregnancy. If you don't get pregnant, once the egg dies, the lining sheds. That is menstruation. So regular menstruation more or less confirms regular ovulation. There's no point wasting money to check whether you're ovulating or not. And then lastly, the timing of sex. You have to meet when the egg is there. These are the things that matter for infertility. Whether it be primary infertility, be secondary infertility. The investigations we do, we investigate for these 4 main things. For the woman's tube, it's an X-ray we call hysterosalpingogram, popularly known as HSG. They inject a dye, which will show the womb and show you the tubes are open. The dye will pass through there. For the man, semen analysis, the very common test any lab can do. It's not sophisticated. It's been done for ages. The sperm, we will count it. You can see the number of sperm, the speed of the sperm. There are two cardinal tests for pregnancy: the woman's tube, the man's sperm. If these two things are okay, a woman can get pregnant. Secondary infertility, like I said, is for a woman who's got pregnant before, cannot get pregnant again. It must be investigated. The other fact that even if the man has a child, if the child is more than 1 year, then the woman should be investigated. Unless a child has another wife who has a baby, then you can excuse the man. It's wrong to investigate a woman alone and blame her. They shouldn't do that. Investigate a couple and let them come to your office together. So the woman will see the man's result, the man will see the woman's result. A doctor should not connive with a man and then discuss